Welcome to today's lecture on systemic fungal infections. We will cover common pathogens, transmission, clinical presentations, diagnosis, treatment, drug resistance, opportunistic infections, immune responses, outbreak investigations, and emerging pathogens. By the end, you will be well prepared to handle these infections in clinical settings. Fungal pathogens, such as Candida, Aspergillus, Cryptococcus neoformans, Histoplasma capsulatum, and Coccidioides immitis, cause systemic infections in immunocompromised individuals. It is important to understand their characteristics and virulence factors for effective diagnosis and treatment. Systemic fungal infections primarily affect individuals with compromised immunity, such as those with HIV/AIDS, organ transplant recipients, patients undergoing chemotherapy, and those with genetic immunodeficiencies. Other significant risk factors include prolonged corticosteroid use of immunosuppressive medications, diabetes mellitus, and neutropenia. Identifying these vulnerable patient populations is essential in early recognition, timely intervention, and prevention of systemic fungal infections. Systemic fungal infections can be acquired through various routes, including inhalation of spores, direct inoculation into wounds, ingestion of contaminated food, and vertical transmission from mother to fetus. Each route of transmission has its unique mechanisms of infection, which must be understood to implement appropriate preventive strategies. For instance, inhalation of fungal spores can lead to pulmonary infections, while direct inoculation can cause localized or disseminated infections, depending on the virulence of the pathogen. Systemic fungal infections can affect multiple organ systems and present with diverse clinical manifestations. Common presentations include fever, fatigue, cough, respiratory distress, skin rashes, joint pain, and central nervous system abnormalities. However, the clinical presentation may vary depending on the underlying immune status of the patient, the site of infection, and the specific fungal pathogen involved. Recognizing these clinical patterns is crucial for early diagnosis and effective management. In the video, we will explore how microscopic examination of clinical specimens helps diagnose systemic fungal infections. We will discuss techniques like co-mount preparation and fungal culture, as well as special stains like PA and GMS, which aid in identifying fungal structures. Accurate evaluation is essential for identifying the specific organism causing the infection. While microscopic examination is valuable, confirming the diagnosis of systemic fungal infections requires a combination of laboratory tests. These tests include fungal culture, serological assays for antibodies and antigens, molecular methods like polymerase chain reaction, PCR, and radiological imaging techniques. Each diagnostic modality has its advantages and limitations, and their appropriate utilization in a clinical context is necessary for accurate diagnosis and initiation of appropriate therapy. Antifungal therapy forms the cornerstone of treatment for systemic fungal infections. Understanding the mechanisms of action, pharmacokinetics, and spectrum of activity of different antifungal agents is crucial for selecting the most appropriate drug for each individual patient. Antifungal drugs target various components of the fungal cell, including the cell wall, cell membrane, and intracellular processes. Furthermore, pharmacokinetic factors, drug interactions, and patient-specific factors must be considered to optimize treatment outcomes and minimize toxicity. The emergence of antifungal drug resistance poses a significant challenge in the management of systemic fungal infections. Resistance can develop through various mechanisms, such as alterations in drug target sites, efflux pump overexpression, and biofilm formation. Understanding the molecular basis of resistance, laboratory methods to detect resistance, and strategies to overcome resistance are crucial for successful patient management. Additionally, appropriate infection control measures are essential to prevent the spread of drug-resistant fungal strains in healthcare settings. Immunocompromised individuals, including those with HIV/AIDS, organ transplant recipients, and patients undergoing immunosuppressive therapy, are susceptible to opportunistic systemic fungal infections. These infections can be caused by various fungal pathogens, such as Pneumocystis jirovecii, Candida species, Cryptococcus neoformans, and Aspergillus species. Prompt recognition and management of these opportunistic infections are crucial to avoid excessive morbidity and mortality in this vulnerable population. The immune system fights fungal infections through a combination of innate and adaptive responses. Innate responses, like phagocytosis and inflammation, are triggered by recognition of fungal components. Adaptive immunity, involving T and B cells, is important for clearing these infections. Studying these immune mechanisms is essential for developing new treatments. Systemic fungal infections can occasionally lead to outbreaks, especially in healthcare settings. Rapid identification, source tracing, and implementation of appropriate infection control measures are vital to limit the spread of infection and protect vulnerable individuals. Outbreak investigations involve epidemiological investigations, environmental sampling, and molecular typing techniques to identify the source and prevent further transmission. These control measures play a crucial role in reducing the impact of systemic fungal infections on public health. The emergence of novel systemic fungal pathogens and the occurrence of superinfections pose significant challenges in clinical practice. Pathogens such as Candida auris, multi-drug-resistant Aspergillus species, and unique drug-resistant Cryptococcus species have been reported globally. These emerging infections often demonstrate increased virulence, greater resistance to antifungal agents, and potential for community transmission. Prompt recognition, timely reporting, and implementation of infection control measures are essential to mitigate the impact of these emerging infections. Note, the summary provided below is 34 words. Please make one adjustment to meet the 33-word limit. Systemic fungal infections are complex challenges in healthcare. Understanding their various causes, transmission, diagnosis, treatment, and resistance is crucial for effective management, improving patient outcomes, and minimizing disease burden.